Hi everybody, it's Adam with HeartValveSurgery.com, and we're at the American Association for Thoracic Surgery meeting in Chicago, Illinois. I'm thrilled to be joined by Dr. Eric Roselli, who is the Chief of Adult Cardiac Surgery at the Cleveland Clinic in Cleveland, Ohio. Dr. Roselli, it is great to see you again, and thanks for being with me today.
Of course, Adam. Always a pleasure.
Yeah, so we're here at AATS, a lot of great information, new research is coming out. I know you're giving talks, we're learning a lot. We're also getting questions from patients all over the world. This one comes in from Cora.
Yeah.
She asks, I've been told I have moderate aortic stenosis and I need surgery in maybe the next 5 to 10 years. What are the most important findings in an echocardiogram report for aortic valve disease? What about aortic valve gradient? I want to actively manage and track the disease, but I don't understand the report.
Yeah, there's a lot of information in those reports, and it's great that patients have access to it through medical charts and everything else. And I don't want you to get too caught up on any one value, Cora. It's a complex thing. But I do think the gradient is probably one of the more important things to measure when you're looking at an echo and you're looking at all these measurements. Remember that when they're looking at an echo and they're giving you these descriptions of how narrow the valve is, how small the opening is, it's all derived. It's all derived from them looking at the flow through the valve, okay? And so it built into the algorithms of these echo machines is a bunch of calculus that looks at the flow through the valve and then derives these numbers. So, and I'm not going to get into the math, but you know, you throw one variable off by a little bit, it can change a complex math equation. It's all based on the principle of flow, like the same principle when you put your thumb on a hose and you make a jet, right? It's because you've narrowed the opening. They're looking at the jet and the velocity of blood flow through that valve. And from that, I think, you know, the gradient is the one I like to pay the most attention to because it's kind of telling me how the blood is flowing through that valve. The gradient gives you an indirect measure of kind of the blood pressure inside the heart and the blood pressure inside the aorta. You want it low. You want your valves to open nice and freely. As it rises, it means that thing's getting tighter and tighter. The jet's getting faster and faster. The heart is working harder and harder. So if your heart starts working too hard against a bad valve and it gets into that severe range, we're learning now it's probably better to get it taken care of sooner than later before you have severe damage to your heart. You have to have the conversations with your doc, though, about what all those details mean. And like I said, don't get too caught up in the little nitty-gritty because sometimes the conditions can be off and a measure might bounce a little bit and those numbers aren't, you know, that precise.
Great. Well, Cora, fantastic question. Dr. Roselli, fantastic response. Thanks for everything you and your team are doing at Cleveland Clinic.
Of course, thanks.
Hi, everybody. It's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel. Watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.